Good morning. I'm Dr. Mark Harrison. I'm President and CEO of Intermountain Healthcare, and I'm joined today by my friend Lydia Jumonville, President and CEO of SCL Health. Thank you for joining us for our very exciting announcement. Before we get to that, I want to make sure that Lydia and I are able to express our deep gratitude to healthcare workers across the United States and beyond who are serving under incredible circumstances during this latest surge of the COVID pandemic. Our deepest respect to them and what they're doing. So today we're thrilled to announce that Intermountain Healthcare and SCL Health, two of the premier leading healthcare, not-for-profit healthcare organizations, have signed a letter of intent to merge. With this merger, we'll create a model population health value-oriented system that provides high quality, affordable, and accessible care to more patients and communities in Utah, Idaho, Nevada, Colorado, Montana, and in Kansas. We feel strongly that American healthcare needs to evolve towards population health and value. This merger accelerates that movement regionally and nationally. We'll bring together the best practices of both organizations, which are substantial and complementary, to provide even more clinical excellence, to transform the patient experience, and to help keep people healthy, as well as take care of them when they're sick. If you're watching this in Colorado, Montana, or Kansas, you might not be familiar with Intermountain. If you're watching this in Utah, Idaho, or Nevada, you may not be completely familiar with SCL Health. I'd like to briefly explain who Intermountain Healthcare is, and then Lydia will provide background on SCL Health. So Intermountain is a not-for-profit based in Salt Lake City, Utah. We serve patients in Idaho and Nevada. Intermountain was formed in 1975 when the Church of Jesus Christ of Latter-day Saints donated their hospitals to the community. Since then, we've been a secular organization without any religious connection. We operate 25 hospitals, one of which is a virtual hospital, and 225 clinics across our 3 states. Intermountain also has a health insurance plan that covers residents in Utah, Idaho, and Nevada. Intermountain's privileged to be the largest employer in Utah and has 42,000 employees who we call caregivers spread across these 3 states. So Lydia, over to you, my friend.
Thank you, Mark. Well, I'm delighted to tell you a little bit about SCL Health. SCL Health is a faith-based nonprofit healthcare organization dedicated to improving the health of the people and communities it serves. We are nationally recognized for our quality of care, and we have expertise in operating an integrated healthcare organization across varied and competitive markets. Now, we were founded in 1864 by the Sisters of Charity of Leavenworth. And now our health network provides comprehensive, coordinated care through 8 hospitals, more than 160 physician clinics, home health, hospice, mental health, and safety net services across 3 states in Colorado, Montana, and Kansas. Now, as Mark mentioned, we are very excited to announce our intent to merge these 2 leading nonprofit healthcare organizations. This is our first step toward joining together to truly build a comprehensive regional healthcare system that will better serve patients, caregivers, and communities. So after a lot of ongoing discussion, thoughtful deliberation, and discernment, our boards of directors and our executive leaders of both organizations strongly believe in the value this merger will bring. So we have strong alignment of mission, vision, values, and a commitment to provide high quality and more affordable care. So one of the things that truly makes this merger different than many others you may have seen in the past is the fact that we are pursuing this from a position of strength. Both organizations are individually successful health systems that seek to increase care quality, accessibility, and affordability. We believe we can advance our missions and better serve our entire region together. So thanks, Mark.
Thank you. And I will simply reiterate what Lydia said so eloquently. This is a move designed to serve people. This is not a turnaround in any way, shape, or form. We're coming from a position of strength, clinically, operationally, and financially. We believe that this combination advances the movement towards healthcare that is designed to keep people healthy, as opposed to just taking care of them when they're sick. So we also believe that there is an enormous opportunity for us to jointly leverage digital and telecare. These scale beautifully, and we both believe in keeping people close to home when they're most in need. We want to keep people in the least expensive, least restrictive environments that can provide them with high quality care. Lydia and I share this value. It's different from many other healthcare systems, and it's something that we believe we'll excel at. Lydia and I both, and our organizations, are committed to rural healthcare. Individually and collectively, we have avoided some of the rural healthcare deserts that have occurred across the United States. And we believe this merger will provide a model system for rural healthcare for the rest of the country. So with that, Lydia, back to you. And getting towards the end of our time, getting ready for Q&A.
So thank you, Mark. As Mark said, this merger is really driven by mission, and it's motivated by community need. And we're going to measure our success of the new organization by our ability to enhance the delivery of high quality, affordable care in our distinct regions. And so to emphasize what Mark just mentioned, this merger will really enable us to create a healthcare organization that is poised to meet the challenging and changing needs of the healthcare landscape. And we're going to be focusing on increasing population health efforts, enhancing opportunities for innovative approaches to care delivery. And as Mark said, we really want to keep care close to home whenever possible, especially for rural, underserved, and vulnerable populations. And we want to provide a network of higher acuity care to patients when they need that care, but not before. And I can't stress enough that we will continue to keep our patients, our caregivers, our communities at the center of our work, especially given the ongoing challenges of the COVID pandemic.
Great. So you all may be wondering what the merged organization looks like. And I do want to emphasize that at this point, there is no geographic overlap in our service area. And we do believe that the contiguous nature offers real opportunity to the region. So the new organization will have an integrated governing board with individuals appointed by both Intermountain Healthcare and SCL Health. They will oversee the combined organization, which will be led by an integrated executive leadership team. I will have the privilege of serving as the president and chief executive officer of the combined organization. Lydia is the current president and CEO of SCL Health, and she will maintain that role and work as part of the executive leadership team during the 2-year integration process. She'll also be a board member on the newly integrated board. And that will really help us ensure the successful integration of these two great systems. Lydia's work will focus on transition and integration, playing a lead role in the collective work of defining growth strategy going forward, and she'll assist in creating the newly integrated leadership team. Lydia and I work beautifully together. I have immense respect for her and like her personally, and I think that will help us on this integration journey. Over time, SCL Health will transition to the Intermountain brand, and SCL Health's Catholic hospitals will retain their names and their Catholic identity. Headquarters of the new organization will be in Salt Lake City, Utah. There'll be a strong regional office in Broomfield, Colorado, where SCL Health is currently headquartered. The combined organization will retain its not-for-profit status. with strong system-level leadership and regional operations across our 6 states. We feel strongly that an operating company is the way to achieve the best results for the people we serve, and that is the model that we will pursue. Upon completion of this merger, the combined health system will employ more than 58,000 caregivers, operate 33 hospitals in 4 states, and run 385 clinics across our 6 states. About 1 million people will be served initially through Intermountain's health insurance company, Select Health. The intent is that a definitive agreement will be finalized and signed by the end of 2021. The merger of the 2 companies is expected to close in early 2022, pending all approvals. This is a great day for our organizations, our caregivers, and the people in the communities we serve. We also believe it's a great day for healthcare in the United States as it promotes and advances the cause of affordable, high quality, and accessible care delivered in a value-based model. With that, Lydia and I are both available to answer any of your questions. Thank you.
Again, if you have questions, submit them in the chat. We've had a few questions come in. Lydia, this first question I think may be best for you. The question is, Intermountain is much larger. Is SCL merging into Intermountain? Who will be the combined leader? And how will you merge the Catholic culture with the secular culture?
Well, all great questions, and that's a lot of them in one. So first of all, as Mark said, we have a lot of common strengths, but we're each bringing things to the table. And while we're really excited about the population health expertise that Intermountain is bringing and the immense telehealth network that they have, we're bringing some key strengths in governance expertise, as well as really effectively integrating a system across multiple states and highly competitive markets. And so we will be putting the board together. Our SCL Health Board, as well as the Intermountain Board, will actually be nominating individuals to the board. And as Mark said, we will have a combined executive leadership team. So I believe that we're going to have as much influence on best practices as they're going to bring to us. And we found that as we've worked so well together. With respect to the Catholic aspects, which are really important to us, Intermountain has just embraced us continuing to maintain our Catholicity. And we actually will, as Mark said, all of the Catholic hospitals will remain Catholic. They will keep their Catholic names. SCL Health itself will remain Catholic. And we still have, we will follow all of the Catholic directives and ERDs, and all of the values of the Catholic hospitals will be there.
If I may just add, in terms of proportionality, during the conversations that have led up to the signed letter of intent, I really credit Lydia and her leadership team with pushing hard for a model that is an operating model across the entire system. And, a clearly defined strategy, clearly defined executive team roles, appropriate delegation to regions. And she has been a full and complete thought partner, and in many instances has led this process. So I hope and expect that that will continue going forward.
And I'll just say something personally that I'm asked a lot over the last few days. I personally am totally excited about this merger. There aren't many times in your career that you get to influence the creation of something that can be so special going forward. So I love working with Mark and his team, and our teams are so aligned. I'm excited about the wonderful things we're going to do together. This is not something we had to do. We chose to do this because we believe this is right for healthcare and for our communities.
Question for Mark. Can you share a ballpark of what the annual revenues of the combined organizations will be?
This is definitely a ballpark. It's interesting. Of all the things that we talk about, the revenue actually is probably the least important thing to us. So we're both super strong financially, clinically, operationally, and we always end up talking about service, mission, and making things more affordable for folks. I think roughly speaking, this will be about a $14 billion annual revenue, but that's roughly speaking.
And a question for Lydia. Will SCL's name change eventually to Intermountain?
Yes, it will. And that's another good question. I'll give you a little bit of the backstory. I think, as everyone knows, Intermountain has an incredible brand, not just in their region, but nationally, and stands for high quality healthcare. SCL Health has actually only been a system using that brand for, about a decade. And so we were actually contemplating changing our brand before COVID hit last year. And so we view this as, again, a wonderful opportunity to go ahead and change our brand to one that is widely recognized. And we'll do that again, over the 2-year period of time. We'll thoughtfully transition that brand. The important thing to our sites, and the thing that everybody really relates to, is the longstanding, the name and the legacy of our care sites. And so that's what's really important to us.
A question here for both Mark and Lydia. The question relates to how this merger will make care more affordable.
So let me give it an initial try, and then Lydia, I'd love for you to chime in. So both of us, both systems have a long-term commitment to both transparency and to affordability. At Intermountain, we've done a number of things that have been difficult operationally with the intent to have our healthcare be more and more affordable. And I will note that we were completely in line with the transparency guidelines that came out last year. I think only about 10% of systems in the U.S. Were completely compliant, and we were one of them. We thought it was really important to do, and based on what we see, we're extremely competitive in terms of what we charge. Even given that, we are driving forward with ASC strategies and outpatient imaging strategies and a number of other approaches which should make care yet more affordable. We also believe that the payer-provider model, done right, drives incredible value to people in terms of keeping them well and making care affordable. This was an important part of our early conversations with SCL Health, and it turns out we're in violent agreement about these priorities, and they have many great examples themselves about being a high quality and low cost provider. Together, we believe we can do even more of this. So this is the opposite of those mergers where people try and come together and exert leverage over commercial insurance to get more money. What we'd really love in the long run is for some of those payers to engage with us in risk-based contracts where we can really work hard at keeping people well. That would be the most exciting thing for us, I believe. So Lydia, over to you, please.
As Mark said, this is an area we are in violent agreement. From the legacy of our sisters, we've always been committed to, a great deal of charity care and community benefit. But as Mark said, there are better ways to truly get to health equity. We need to increase access. We need to try to keep people out of the hospitals, move more into the home, more through telehealth. And those are things that we've been doing, but I think we need to accelerate it. And I believe that we can accelerate all of these efforts working together with Intermountain.
Question here from Mark. The Biden administration has said that hospital mergers will get added scrutiny. Can you address that?
Look, I'm no regulatory whiz, but as far as I can tell, we have no geographic overlap. We have minimal payer overlap, and if you can find two systems that have been more committed to keeping costs down, please show them to us, and in the context of good quality. So in many ways, I believe that we represent the model merger. We're trying to do the right thing. We're trying to move towards value, which has been one of the hallmarks of the Biden administration. So we'll see what the regulators say, but we're very straightforward folks. We're very straightforward organizations. We believe our track records are good and that we do not ping any of the traditional concerns around mergers historically.
Question for Lydia. How will this merger impact SCL's partnership with Kaiser?
We don't expect there to be anything except strengthening our relationship with Kaiser through this. In fact, I've had conversation with Kaiser leaders yesterday, and I think Mark may have as well. Both organizations have really good relationships with Kaiser. Again, one of the things that we've enjoyed with Kaiser, and one of the reasons they like to work with us, is because we are a high quality, low cost provider. And so we will continue to do that for them. They're a great partner, and we hope that that partnership just continues and gets stronger and stronger.
A question for both Mark and Lydia. It's regarding the role that Intermountain's health insurance plan, Select Health, will play in the merger.
Lydia, do you want to go first, or would you like me to go first on this one?
I'll start it just with a very simple statement. We've had no discussions at all about doing anything with Select Health. So I'll start with that. And Mark, if you want to go forward, go ahead.
So we've been really careful at this point, I think appropriately so. Perhaps as we go through additional due diligence, and we can talk in different kinds of ways, we'll identify a role, but at this point in time, we do not have a Select Health strategy for the merger. And I will say that Select SCL's footprint may not be monolithic either. There may be market by market applications for health, or there may not be. We'll see. Most important thing is to get to value, though. And I think that's the tools that we have in our toolbox are large and different tools for different situations.
Question for Lydia. Did the merger talks precede the pandemic, or were they spurred by the pandemic?
Actually, neither. So they weren't spurred by the pandemic at all. In fact, both of our organizations have done really well through the pandemic, and probably we've gotten stronger culturally and operationally and a whole lot of other ways. I think the one thing about the pandemic that we saw is that we saw how each organization navigated the pandemic, and I think it just raised our respect for each other because we could see our values and our culture in action. And so I would say that was a real positive. We had no discussions before the pandemic, although we have had a few years of relationship, mutual respect, where our teams really got together pretty often to talk about best practices and really to share those with each other. We've worked with Intermountain a little bit in some of our more rural markets. They provide some pediatric support to us up in Montana, out in the western slope of Colorado. We use some of their telehealth services. So those are just some examples of how this merger really just evolved because we already had a good relationship and we had a vision of what we thought a new model healthcare system could be in the western part of the country.
Are there plans to expand and add facilities across the states that the combined organization will serve? And will there be the possibility of being able to share resources to address the COVID pandemic?
So it would have been inappropriate to do market planning at this point. And so I can say there are no plans for specific communities or specific markets. I think generally speaking, and I believe Lydia and I are on the same page with this, let's see what the communities need. I believe in an asset-light model wherever we can do things because it's less expensive and we can pass those savings along to people. But let's see what people need. And I think then we have enough clinical, operational, and financial strength that we should be able to meet those needs.
A question for both of you. What changes can patients or staff expect from the merger? And do you expect the merger to result in cutting staff?
Do you want to go with this one, Lydia? And I'll follow on if you.
I'll start, you follow on. I think one of the important things I'll start with is this merger is not being done because we personally need to cut cost or be bailed out or have any kind of a turnaround. That's not why it's being done. We already, as we both said, operate very efficiently. And because we have no geographic overlap of our markets, we expect very little change with any of our care sites. And that's what we call our hospitals and clinics. So we don't expect anything to impact them at all, other than to maybe get more access to, innovative approaches and, telehealth and digital and all of that. With respect to our system services, we're already pretty efficient. And Mark and I early on concluded, I think this is one of the few things that was positive through COVID is that we've all learned remote work is very successful. It can be very productive and successful. So right now, we're not talking about any relocations or anything like that. So I would say, yes, do we have things that happen anyway naturally as a system, but certainly not anything because of this merger.
And the only thing I'd add to that excellent and accurate response is that both systems have very crisp operating models, and we will bring them together into a single operating model, and that allows people to have lots of decision rights, to move quickly, to solve problems locally, yet remain really tied to the system strategy and expectations for performance. And I love what Lydia said. We do not have a geographic. There are just maybe a handful of jobs in the entire enterprise beyond the clinical jobs that would necessitate geographic relocation, and that's probably less than literally one hand. So I think this is going to be really good for people, and their day-to-day work hopefully will only get easier and better with the new tools that collectively we can bring to bear, and good for their patients. Probably enough said.
I'll add one more thing. I've talked to a lot of our leaders over the last, weeks, and overwhelmingly, most of them are excited about the opportunities. I think they see something exciting here that's going to grow and actually potentially give them more opportunities than they had before. And so I think that's the way we're all looking at it.
Question for both of you. Mark, can you address the merger which was announced last year with Sanford Health that didn't take place? And also, Lydia, can you kind of talk about timing of the discussions with Intermountain?
So I guess I'll start. Darren asked me to lead off. So good things come out of every situation is probably what I'd say. Learn something really important about our Sanford discussions. Maybe learned a couple of important things. One is leadership change in the middle of LOI discussions can be very disruptive. And we maintain a lot of respect for our colleagues at Sanford. We wish them well. Happy to collaborate with them going forward on any number of things. But that leadership change did derail things. The other thing we learned is that it's really good to have very detailed conversations before getting to LOI. And Lydia and I have had great and tough and honest and straightforward conversations that have led our organizations to a place where there's a lot of mutual comfort about what a final agreement might look like. And we're really excited about that. And I think those are really good investments. And then maybe the final thing I'll say is maybe the best thing that came out of the Sanford experience is it opened SCL's eyes to the fact that Intermountain might be interested in expanding outside of its traditional borders. And we had a great conversation soon thereafter, and here we are today. So over to you, Lydia.
Well, I think that kind of answers the timing question. Yeah, like I said, we'd had a great relationship with Intermountain over the years, but I think when the Sanford merger was announced and when then called off, we said, well, we really didn't know they were interested seriously in moving outside of Utah. And so, yeah, I think that initiated then a lot of discussions to where we all just really openly looked at what the possibilities would be.
Question for both of you related to how this merger will affect the cost of healthcare. Will there be price increases? Do we expect pushback from health insurers?
Well, I will start. I can't guarantee that prices will never go up, but please look at our track record. And it's been interesting as we've engaged in this transparency exercise. We've gotten a lot of calls from payers who seem really interested in working with us, and I think they're understanding that objectively speaking, we truly are a high quality and low cost provider, and there are things we might be able to do together. So I think that the future is bright with regards to that. And please watch us and hold us accountable to be responsible. We have historically in both organizations been very responsible and responsive, and we'll continue to do our very best.
I totally agree with that. And I would just say we have great relationships with our payers. And I think our payers would generally tell you that they believe we really are committed to affordability and being that high quality, low cost provider. So I think they're going to think it's a good thing. And some of the calls that I've already received says they do.
A question here for both of you too. What will be the composition of the Board of Trustees?
Lydia, would you like to go ahead and address that?
Yeah, good question. They have not, that is something they'll be working on this fall before we get to final agreement. One of the great things is we've had our board started working together this summer. And again, they saw the incredible alignment of our culture and the way we operate, just like Mark and I and our teams did. And so they've agreed that they will come together this fall and work on each side nominating individuals for the board and making sure that we get the right complement of people with different expertise and diversity across all elements. And so, that's what they'll be doing. That work is to come.
One of the things that I have found to be really heartening, listening to both of the boards, is there is a strong commitment to have this new Intermountain board be a true enterprise board. And, with a desire to avoid having this be a parliament or a Congress with people representing or standing up for a geography, I think my sense is they want to stand up for a new model of healthcare that's geographically agnostic.
All right, last question. This revolves around the COVID vaccine, asking about whether or not COVID vaccine is required and whether the merger would change anything in regard to that.
Do you want to describe your stance?
I'll start with our situation. SCL Health is requiring the vaccine of its workers, really in accordance with, our state law. And so that's kind of what we had already come out with. And then again, we're like everyone else is evaluating, what we would need to do any differently, if anything, with respect to the order that came out from the administration.
Agreed. At Intermountain, we have not mandated the vaccine. We're north of 80% vaccinated and climbing every day. And I will be quite frank. I believe that the public health emergency is around the hundreds of thousands and millions of people in the community who are in our communities who are not vaccinated. That's the crisis. And I will also say that Intermountain has always been compliant with federal regulations. And, we would never leave our patients in a lurch. So we'll do whatever we need to do so that we can take care of people, which that's our job. We're supposed to take care of them and keep them well. And when we can't do that, we're going to do everything we can to make sure we can take care of them when they're sick.